Mr. President, I spent most of my career in management consulting, managing large, complex enterprise projects, multi-year, thousands of hours, a lot of complexity that take people, process, and technology to make it work. I learned a lot in that career, and I was able to go to the legislature and take that mindset as a member of the minority for 2 terms, and then we got a majority in 2010, and I found myself being the Speaker of the House. Mr. President, we were in the middle of the financial crisis. When I got sworn in January of 2011, North Carolina had a $2 billion shortfall on a $20 billion general revenue fund. And I had 6 months to balance that budget. Well, Mr. President, we did something that had not been done in North Carolina. We took the time to understand every aspect and every dollar that was being spent in government. We determined how to cut government in a way that was sustainable. We cut 12% from the university system budget. Not the rate of growth, but the actual spending. And I had some people say that it was going to be disruptive and the University of North Carolina would never be the same again. But, Mr. President, we did it in a way that was instructed by the operations of the university system. And we did it in a way in concert with the chancellors. And you know what happened, Mr. President? We actually balanced the budget. We did do those cuts. And the last time I checked, the North Carolina university system is still considered one of the greatest systems in the United States of America. Why do I use that example? Because the Medicaid proposal in this bill bears no resemblance to that kind of discipline and due diligence. It has no insights into how these provider tax cuts are going to be absorbed without harming people on Medicare. And even worse, most of my colleagues do not even understand on either side of the aisle the interplay of state-directed payments and the devastating consequences of the funding flows that are going to be before us. Mr. President, here's how I figured out the impact in North Carolina. I used to be Speaker of the House, and I like the Speaker and have good relationship with the Speaker and the President pro tem, so I called them up. And I had my staff ask them if they would do an economic impact assessment on what this proposed bill would do to the Medicaid program in North Carolina. But I didn't want just the view of the Republican partisan staff that reports to the Speaker and the President pro tem on how they're going to absorb this bill. I decided to go to Josh Stein, the governor, and I went to his Democrat staff for Medicaid. I asked them to prepare an estimate, independent of the estimate that I had done with fiscal research. But I took a step further, Mr. President. I went to the Hospital Association. I asked 3 different independent groups, a partisan Democrat group, a partisan Republican group of experts, and a nonpartisan group of the Hospital Association to develop an impact assessment independent, not talking, not sharing, reporting to me. And what I found is the best case scenario is about a $26 billion cut. Now, we've got a delay, so it may be 2 years, it may be 1 year. All it does is make that $26 billion happen in year 1 or year 12, but the impact is the same, Mr. President, and it's indisputable. Now, when I actually presented this report that you can find on my website, I had people in the administration say, "You're all wet, you don't know what you're doing." I said, well, why don't we assemble a series of meetings? We're going to provide you our analytics. You go through it, tear it apart. And I told about Mehmet Oz, who I consider to be one of the most capable people in the Trump administration. He's a brilliant man, and I'd encourage my Democrat colleagues to talk to him. He knows his stuff, and he's very focused on getting efficiencies out of CMS. So we had 3 different conference calls with CMS, with Oz on the phone and on the video, and me on the video. And I said this, guys, I would love nothing more than you to prove me wrong. I would love nothing more for you to tell me it's not $26 billion or $30 billion, that it's $2.6 billion or $2 billion or $200 million. But after 3 different attempts for them to discredit our estimates, the day before yesterday, they admitted that we were right. That between the state-directed payments and the cuts scheduled in this bill, there's a reduction of state-directed payments. And then there's the reduction of the provider tax. They can't find a hole in my estimate. So what they told me is that, yeah, it's rough, but North Carolina's used the system. They're going to have to make it work. All right. So what do I tell 663,000 people in 2 years or 3 years when President Trump breaks his promise by pushing them off of Medicaid because the funding's not there anymore, guys? In the White House, senators advising the president are not telling him that the effect of this bill is to break a promise. And you know, the last time I saw a promise broken around health care, with respect to my friends on the other side of the aisle, it's when somebody said, if you like your health care, you can keep it. If you like your doctor, you can keep it. We found out that wasn't true. That made me the second Republican Speaker of the House since the Civil War, ladies and gentlemen, because we betrayed the promise to the American people. 2 years later, 3 years later, it actually made me a U.S. Senator, because in 2010, it had just been proposed. And just anticipation of what was going to happen was enough to have a sea change election that swept Republicans into the majority for the second time in 100 years. Now, Republicans are about to make a mistake on health care and betraying a promise. It is inescapable that this bill in its current form will betray the very promise that Donald J. Trump made in the Oval Office or in the cabinet room when I was there with finance, where he said we can go after waste, fraud, and abuse on any programs. Now, those amateurs that are advising him, not Dr. Oz, I'm talking about White House healthcare experts, refuse to tell him that those instructions that were to eliminate waste, fraud, and abuse all of a sudden eliminates a government program that's called the provider tax. We have morphed a legal construct that admittedly has been abused and should be eliminated into waste, fraud, and abuse. Money laundering. Read the code. Look at how long it's been there. I was Speaker of the House. I refused to do it. When I left North Carolina, I said, we're not going to do a provider tax. I left it at 2.5%. Now it's 6%. Mistake on the part of the leadership. And frankly, I know my friends are probably going to think I'm a little bit crazy here, but I actually passed a law that made it illegal to expand Medicaid. Why did I do that? Because I was convinced someday we would be here. And I would have rather found a way to get more people on Medicaid at the standard FMAP than having this 90-10 match and watching it disappear and taking away desperately needed health care. So, Mr. President, over the course of the evening, I may look for an opportunity to speak again. But I'm telling the President that you have been misinformed. You supporting the Senate mark will hurt people who are eligible and qualified for Medicaid. I love the work requirement. I love the other reforms in this bill. They are necessary, and I appreciate the leadership of the House for putting it in there. In fact, I like the work of the House so much that I wouldn't be having to do this speech if we simply started with the House mark. I've talked with my colleagues in North Carolina. I know that we can do that, and I believe that we can make sure that we do not break the promise of Donald J. Trump that he's made to the people who are on Medicaid today, Mr. President. But what we're doing, because we've got a view on an artificial deadline on July 4th that means nothing but another date and time, we could take the time to get this right if we lay down the House mark of the Medicaid bill and fix it. And I know that my friend and colleague from New Hampshire, I jumped in front of her, so I'm only going to take another minute or two. But, Mr. President, we owe it to the states to do the work to understand how these proposals affect them. How hard is that? I did it. How hard is it? How hard is it to sit down and ask the Medicaid office, ask the legislative staff, ask the Independent Hospital Association what the impact is? If there's no negative impact, what's wrong with daylight? What's wrong with actually understanding what this bill does? Mr. President, I know what it does because I spent a career implementing complex systems, and then I had the privilege of being Speaker of the House, and I implemented them in a government setting. And since I've been here, I've focused on bills and watched their implementation from the cradle until they're fully implemented. Mr. President, we owe it to the American people, and I owe it to the people of North Carolina to withhold my affirmative vote until it's demonstrated to me that we've done our homework. We're going to make sure that we fulfill the promise, and then I can feel good about a bill that I'm willing to vote for. But until that time, I will be withholding my vote.